I'm Scott McGohan.
And I'm Anne-Marie Singleton.
Now, I think even for our listeners, too, I think what's important is we might be right, we might be wrong. But one thing is, we're not afraid.
Right. And we have a point of view, and I think that people should hear it. And we're unscripted. We just have free reign for 20 minutes.
Welcome to Side Effects with an A. Welcome back to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
So, Anne, we have this little mystery behind us.
We have a brand new green screen located behind us. So right now, we don't know what's playing behind us.
You know what I would like to do is I could call out the weather.
Right.
So on the East Coast, over here.
We could have done that easily over the weekend.
Massive
right?
front.
Yeah.
Talk about weather across the United States because we don't know what our team's actually going to put behind us.
Right, right. I think one of them said it could be dogs playing poker. We're not sure.
That would be
they
good.
could be totally mocking us right now.
So do you think they do anyway?
Yes, for sure.
Yeah,
but
they
hopefully
probably
not.
do.
Hopefully not in our production. So, but technology, it's awesome. It's amazing, and that's our topic for today.
Yeah, and I think when we talk to other brokers, employers, and we talk about this big news that hit our industry, probably about 60 days ago.
Yeah,
is
late January.
Amazon, Berkshire Hathaway, J.P. Morgan's going to change the landscape of healthcare.
Right.
So
it certainly changed the landscape of the stock market that day for the health plans.
Yeah.
Their big announcement, and it's been pretty quiet since then, right? But this big announcement that they're going to revolutionize or disrupt the way healthcare is delivered today for their workforce.
Well, I think you said something really important too. Is I think America read that and said those three organizations are going to come after health care and they're going to fix health care for America.
Right.
I think what is they were very specific and they said, no, we're going to address this for our workforce.
Right, right. So combined, they have about 1 million employees globally, about 500,000 in the U.S. And so compared to those that are insured under an employer health plan today, it's about 150 million people insured under an employer health plan today. So it's a small fraction of the total workforce, but combined, they might just have some ideas around care delivery.
Yeah, and you would think about you and I are close to the same age. I'm older.
Yeah, slightly. Always. You'll always be slightly older.
Yes. I can't change that.
No.
No. If I could, that would be technology we should really talk about.
Right. That'd be a whole different podcast.
But growing up with, especially here in our town, we had Barnes & Noble, we had Amazon. And first hearing about Amazon, I don't think either of us had any prediction of where this company was going to go.
No, none at all. I mean, and for those of you that are listening that know that, I mean, and if you've ever heard Mike Sutton, our president, talk about it, like, who's going to buy a book online? Like, that's so crazy, right? I order stuff on there pretty much every day. I mean, literally an Amazon package arrives at my house almost daily.
I think even some of the things like a printer ink for my Hewlett-Packard printer. So it's number 63. So I normally have to take a picture of my phone. I have to think about driving to the store. But no, like last time, like I ordered on Amazon, I can reorder that.
Right.
And it's to my house in a couple of days. And instead of ordering one, why not order a couple so I don't run out?
Yeah.
And then even K-Cups.
Right, right.
So I love coffee. I'm
Right.
addicted to it. And it shows up monthly on my front door.
Right.
Dog food.
Right.
Yeah.
Yeah, it just shows up. And so the point of that is they can change the way that consumers purchase consumer goods. Can these three companies change the way that their workforce and ultimately consumers purchase healthcare?
Well, I think they can. They've certainly changed the landscape of retail. Unfortunately, we just heard about Toys R Us,
right,
closing thousands of stores, hundreds of thousands of employees. That's destructive and disruptive
right.
at the same time.
Right.
And we're talking about an Amazon being a company that I believe $200 billion company.
Yeah, and when we talk about this, it's not that we're looking to replace local providers, right? That we're proponents of replacing local providers and making people get health care, in ways that's not delivered locally. But the idea behind it and the perhaps cost savings associated with it, just thinking about their focus on technology. So simplifying the experience for a member to get a primary care physician or to go see a primary care physician, focusing on high quality care, right? And then having it be transparent. These are things that we're already talking about in the healthcare space that we've been talking about for 10 years or more. They're just focusing on how do they get their workforce connected to primary care in the right way, in an easy way. Sort of like on the Open Table app. Have you ever made a reservation on Open Table?
Mm-hmm.
You go on, you choose your time, you choose your place, send you an email and a text. Super easy. If you need to change it or modify it, you go back. I mean, that's pretty cool, right?
I think what's interesting about that, and right now we're just talking about like Amazon and can they make a difference. When we first heard about this, we had a lot of conversations with even employees.
Mm-hmm.
Like, does that scare you? It's like, no, that doesn't scare me. Actually, I'm pretty enthusiastic, pretty excited about it.
Yeah.
Because if they can disrupt retail and disrupt transactions and drive transparency and make this transparent with products, including dog food, K-cups, and
Printer ink.
printer ink,
That's a boring.
which has
story.
margins
Those are boring purchases.
far outweigh healthcare. We do believe that they can disrupt healthcare.
Yeah.
I mean, they're a $200 billion organization, gigantic. And then you think about Berkshire Hathaway.
Right.
So what do they do? What are
Right.
they going to bring to the table?
Money.
Massive amounts of capital.
Right.
And then they own Geico.
Yep.
So you think about, buying car insurance from a lizard today versus buying it from your local insurance broker or agent.
On the corner. Yeah.
And it's a different transaction.
Totally different. But it's not a bad thing. It's progress. I do think it's progress and it's moving forward. And if you read anything about this partnership, they haven't announced what they're going to do, just that they're thinking about it, what they'd like to do, right? It's been pretty quiet for the last 60 days since the news hit. But there were some folks that talked about, wow, that's really cute, right?
Yeah.
Others have tried this before. This isn't a new idea. Why do these three organizations think that they can now make a difference? If you think about it, in 1915, Henry Ford started a hospital for his workforce. That hospital's still around today, right? So he was trying to bring care delivery to his workforce in a different way. Walmart has done things where they've contracted directly with certain organizations, most notably the Cleveland Clinic, so that they have a direct relationship. They've avoided the health plans altogether and gone to a care delivery system that brings quality care to their workforce. So there's examples of this left and right out there. The Healthcare Transformation Alliance, 46 companies, including Coca-Cola, where they're trying to make a dent and a difference in healthcare. I think what we've got with these three employers, J.P. Morgan, Berkshire, and Amazon, is the knowledge, the technology, and the dollars to perhaps deliver it in a way we haven't seen so far.
Yeah, which should be exciting for us, in a country that spends $3.5 trillion for healthcare in a process that is a little archaic. And you think about Amazon's ability to take transactions and make it more transparent and simple for
Right.
people to navigate. Berkshire Hathaway's access to capital, their experience in a consumer-driven model with Geico. And then you think about J.P. Morgan and their experience with transactions on a credit card. I mean, I can be in Rome and use my Fifth Third card or PNC card or Right Pat Credit Union card, and I can get money out of my account in Italy.
Right.
And unfortunately, today, even with Epic, all electronic transactions, sometimes my own doctor in my own health system can't get access to my MRI.
Yeah. So Epic is the data platform that most hospitals run on, right? And so it's having access to care, electronic medical records. We're behind. We're way behind.
Way behind.
And truthfully, we were way behind on the electronic side in the financial services realm too. I mean, in Europe, individuals have been moving money to each other. If I owed you some money for dinner, I could send it to you electronically 20 years ago. Everybody thinks it's like a miracle that we can do that now in the United States. But it's been around a long time. We were just slow to adopt because of the rules, and we want the data to be safe, and there's PHI and on and on.
Well, not only that, but there's different organizations that are selling that engine for that data. and they're not cooperating with each other.
Yeah, the platform's not the same. So
Yeah.
how do we receive the records? How do we send them? No one will agree on what that looks like.
And most of us have experienced, at least here recently, we go to our primary care physician, and hopefully you've experienced this. If not, you should probably ask some questions around what your physician's doing. But for the most part, paper's disappeared.
Right. They
Right.
come in with their iPad or their tablet, and I got my first My Chart experience recently where it's like, hey, your tests have arrived. My bill had arrived too, but everything had arrived electronically
Yeah.
in my record, which was great, right? It's good for me. I don't have to worry about the paper, where it is. They don't have to mail me anything. So we're progressing. We're getting there.
Yeah, so what,
as a
when,
nation.
when I think about this too, I think even on Bloomberg this morning, it came out and said that, look, this noise around Amazon and this noise around Berkshire Hathaway and also J.P. Morgan, right now, they're dark. So, and I think what's important for our listeners to understand is they're talking about how to address the workforce. However,
Right.
it's creating amazing curiosity with the insurance industry, healthcare systems, doctors.
Right. Everyone wants to know what are they doing. And the thing is, they've been talking about this for a long time, obviously, before they made this announcement. These gentlemen know each other. It wasn't like they just decided to one day make this announcement out there. They have been talking about it and thinking about it. What they're doing now, wouldn't we all really like to know and understand that? But I think the answer is they're doing something. I don't think they just made an announcement and they're walking away. I think they're serious about making a dent in this and making a dent in healthcare for their workforce. And knowing what we all know about these great entrepreneurs, I think they're serious about making a dent in the care delivery system in the United States.
Well, I think it's a clear possibility that they can. There's no question around those three entities can make a serious dent in regards to how we buy insurance, how we buy healthcare services, what that looks like. Hopefully be able to address issues in regards to not only how I access it, but what's the quality of the healthcare system,
Right.
right? And what does that look like? And then what if I could look at all of that and then also pay for it right here off my phone,
Right.
which is the transaction behind it. So technology, I've always said this industry, we're somewhat lucky in the fact that we don't have to be that great because we're still dealing with this.
Yeah. We have a lot of paper.
Yeah, and if we were in another industry that is driven by technology, healthcare would have gone out of business decades ago. However, healthcare is still delivered by people.
Right.
It's still about relationships.
Agreed. It's a very personal transaction, probably the most personal consumer transaction that there is. And it's expensive. And so that's the real crux of all of this. I mean, last year, the family rate, depending on what you read, the study I was reading, $18,000 a year for family coverage, up almost 20% since 2012. And now employees are paying around 30% of that. I mean, it's starting to really pinch the employee side. It's been pinching the employer side. And that's the reason these three giants came together and said, we got to do something about this. And we think we're the right people to do it.
Yeah, if we've got 20% of our economy that's chewing and just gobbling up our dollars, and especially the workers in this country. It's obviously, with employers paying 75% of the cost of health care, it's a big burden on the economy. But when you think of the single moms out there or the folks out there that are paying significant amount of money in regards to contributions, and the advent of consumer-driven health care, which has led to HSAs, which has led
Higher
to
deductibles.
gigantic deductibles. People
Right.
might have health care.
Yeah.
They might have health insurance. They don't have access to care.
Right.
And could this technology shift and kind of torque all of those elements? We think it can.
Yeah, I think so too. So, I think if you could finish this sentence, if you could use technology in healthcare, what would you use? What would you do if you could use technology in healthcare? What would be the one thing that you would think is most important?
Well, I think, we've talked about on other episodes of side effects. So it's the advent of psychographic segmentation. So I'm like a self-achiever. So I want to know.
No.
Seriously? Yeah. So I want to know things, and I want to know things quickly. So quality is important. Price is important. in my own world, it's speed that information.
Yeah.
I have a lot of apps on my phone. A lot of them are really clunky and they're slow.
So you're making the technology personal and useful to the user, making it not the same user experience for every person, making it actually talk to the person and get them to engage in the appropriate way.
So let me ask you the same question. What would be important to you?
Yeah, I think for me, it's convenience, right? So I want technology to make things convenient for me. I want technology to make it easy for me. So I'm not so concerned about it speaking directly to me with the right words. I actually would be okay if some of the words even made me angry or put me off, but I would be overjoyed if I was able to access things quickly and the first time. So I am that person you talk about, right? A single mom with 2 kids, teenagers, a busy job, and a busy life. I need everything to happen when I need it to happen. So that, I guess, speed is a part of that element, but it's really the convenience piece. And so how can that be delivered to me through technology for my own health care?
Yeah, and I think one of the things that we see in all of this is what people want and desire is simplicity. And unfortunately, Toys R Us is a good example. People like going to the toy store.
Yeah.
They like taking their kids there at Christmas time.
It's an experience.
They love the experience. I'm sure the people that work there love that. Unfortunately, somebody made it simple.
Right.
And made the transactions fast. Now, we'll pay for that economically.
Oh, sure.
As a country. However, when you talk of healthcare and $3.5 trillion, a large bulk of that is waste
Yep.
because we can't figure this out.
Right. Right.
And if we can make it simple, we can make it faster, we can make it better, we can make it more transparent. My gut and my heart says, and maybe I need a cape of optimism, but I think if we believe, if we're skeptics, then shame on us
Right.
around this technology. Because I think the one thing this technology, Amazon, Berkshire Hathaway, and JP Morgan, the one thing it says is we've got hope.
Right.
Because we need hope.
Right. Hope, ideas, and money.
Mm-hmm.
They all go together.
Yeah.
I mean, but hope is where it starts, right? An idea and the hope and the cape of optimism, which I do think you have in your office. I think I saw it hanging in there.
Yes.
I think there's an opportunity. I'm super excited about it. I wish there'd be some more news about it. I've been searching and looking every day. There's not much out there, but there will be.
We have a good friend of ours in Dallas, Holmes Murphy, and a good friend of Ann and I's, Den Bishop, wrote a small white paper in regards to what this looks like. We'll push that out on healthierbirthdays.com. Also, we're up here and we're just Googling Amazon, healthcare, and we're seeing a lot of information in regards to what's happening in the marketplace today. All of their stocks took an enormous bump on noise,
Right.
not necessarily strategy
Or fact.
but I'm not a skeptic.
Yeah.
I'm a believer.
Yeah. Me too. So thanks for listening.
Absolutely. Join us next time on Side Effects. Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
On Side Effects.